Hi.
Hi, how are you?
All right. How are you doing today?
Good, thank you.
All right. So you just want to jump in on this? I'm a huge fan of your page, by the way. The way that I just feel like it's so raw and truthful how you go about talking about endometriosis. And that's very hard to find. Like, just, it's not pretty always, as you know. It's
Yes,
a
yes.
lot of hard to look at and read about sometimes, but it's the truth, and I think that is the most important thing about it. How long have you been officially diagnosed?
7 years. Well, a little over 7 years now.
Oh,
Um,
wow.
yeah. I always had really heavy period and painful period, but
Mhm.
I never thought it was something so drastic. And I think in 2015 there was this one time when I was having really bad pain outside my period, maybe around
Mhm.
ovulation time, and initially I thought it might be just my PMS and it will get better.
Yeah.
Um, but then when it didn't get better after 2 months, and it was just throughout 24 hours,
Oh, wow.
um, so I had to go and see my GP.
Mhm.
Luckily, I think I'm very lucky in terms of my diagnosis. My GP sent me for an ultrasound scan straight away. It was a transvaginal, and then a normal ultrasound as well. And she said that she thinks it could be endometriosis on my first appointment.
Wow. Yes, that is
Yes,
very
because
lucky.
yeah,
Yeah.
the people who are like waiting for 17 to 20 years,
Mhm.
and it takes time, like, average time for get diagnosis is 7 years in the UK. So I thought I was very, very lucky that she just told me that it looks like endometriosis. I'm going to send you for a scan. You make a diary of your symptoms for the next 1 month. And if things do not get better, then we will take it forward. Um, and I had the ultrasound scan. The radiologist told me that there might have been a cyst that would have ruptured, or, just a fluid filled
Like,
cyst.
did the
So,
endometriosis show up in your original
no,
transvaginal
no, it
ultrasound?
did not.
I didn't think so. Yeah.
Yeah, and I went back to the GP, and because the issue still persisted, and she said I can offer you a laparoscopy straight away,
Mhm.
or I could, or you, if you want to go on contraceptive pills to stop bleeding and see if it helps. And I was quite afraid at that time of, to have a surgery. Laparoscopy is actually a
Yeah.
surgery, and I was quite young. I was in uni, and I did not want to take time off my final year at the uni.
Mhm.
So I said, no, I'll go for the pills and see how it goes. Maybe it will help. I did not know anything about this condition at the time. This was the first time I was hearing about this condition. And I took the pills, which did not really help my condition. It made me bleed more.
Yeah.
And,
Mhm.
after 3 months,
Right.
I would go on bleeding for at least 3 to 4 weeks.
Mhm.
And it was heavy bleeding with clots, and it started affecting my mental health badly. I started putting on a lot of weight. I used to play squash professionally.
Mhm. Wow.
And sorry?
That's cool. That
Yeah.
very cool to know.
Yes. So because I used to do weights and all the training for my legs, and because of endometriosis, I had to stop it. I started putting on a lot of weight on my legs. So the thing is, I could not wear dresses. Like, they would be too loose on my shoulders and really tight on my thighs.
Mhm.
So it all affected my mental health severely. Um, and in June the following year, I collapsed and I was taken into A&E. I had to be an inpatient for 2 days because they thought maybe it's a ruptured cyst, and they could not send me back because in case anything happens, then it could be fatal.
Yes.
And that's when the gynecologist decided that there's no, that they can't do anything, but they have to perform a laparoscopy. And within, I think, 3 months, I was given a date for laparoscopy, and I had my first surgery in which they found endometriosis on my left pelvic wall and pouch of Douglas, and some other um, organs were involved. But because I did not know about the condition much, I did not ask questions. After
Mm-hmm.
6 weeks, I was discharged from the care of the gynecology, and they said everything's fine, endometriosis removed, you are well and good to go. We are not going to see you again. And I was like, yay, it's all over, fine. I'm going to be fine.
Unfortunately, it doesn't work that way, though.
No, it doesn't. And then the pain was back.
Hmm.
And I asked for another consultation, and I said the pain hasn't gone back and it's become worse now. And after that, I was told that maybe it's something to do with gastroenterology. Will you go and give a stool sample, get other tests done? And that was the
Can I
worst
back,
gastro.
can I back up real quick? So when you had the surgery, your pain got a little bit better. How
For
long, how long of a time span was that
six
relief?
weeks.
So not very long at all. I
No,
mean, one day is good to have, but it's not definitely a long-term
no.
solution.
So my periods, the moment my periods started again and I started ovulating again, it became bad. They did not offer me anything to stop my period at that time because with endometriosis, you need to have
Yeah.
like something, even if they had offered me contraception, marina coil, or something to go in, it might have helped, not so that, it wouldn't have regrown if they had removed it, but they did not.
Mhm.
And the gastroenterologist was quite, I mean, it was a quite traumatic experience with them because they told me I was 22 then, and their answer was there's some pains you have to learn to live with.
Yeah. None of us
And
should have to learn, especially now. And thank you again for doing this video because I think a lot of people think surgery is the answer and then just go on your way and or just live with it. But with all the research and knowledge and capability we have, I really think this is one that science can get more help out there for us for
yeah, and
continue.
I
You're
think they don't get much funding on it. And nowadays,
not
it's
at
been
all.
taken into the parliament in the UK to get more funding and research because it is very important to research that what is the cause. We don't even know what is the underlying cause. What causes it? Is it hereditary, genetics, stress induced? Is it
Hmm.
something else? We don't know the answers. And what causes it to regrow? Um,
Exactly. What
yeah.
causes it to come back? Why isn't it removing it is your
Yes.
solution? Yes.
Yes, and a very recent research by Dr. Horn in University of Edinburgh showed that the laparoscopy is actually not helping women. It's actually causing more pain.
More, I was just about to say that. Just as you had more pain come back,
Yes,
I also, when I was in university, had a surgery and they removed all of it. They put my organs back, detached them, put them back together. And I did get lucky. I was pain free for 3 whole months. But when it came back on a whole nother level,
yes,
making it so much worse than it was before surgery. So
yes.
it
Yeah,
if you
because when they're cutting into your organs or removing the adhesions and lesions, they're cutting into nerve endings as well. So that becomes the nerve pain.
and it causes
Endometriosis pain is,
more scar tissue. Yeah.
yes.
And
And the problem is people don't even like accept it. When I tell my doctors that I have pain which might be because of endometriosis, but it is in a different part of my body, and it could be because you performed a surgery there and it might have affected the nerve endings. Oh, this is not endometriosis pain. And I've had all kind of doctors, from really really helpful doctors to dismissive doctors
I yes.
um, who did not believe that I was in pain, to a point where my mental health became so bad that I'll put a trigger warning here, that I actually went into self-harming and thinking of ending my life.
Oh no.
Because at 22, 23, when you're graduating from university, you have a whole world to at your you know uh, you could do whatever you want to do. That's when you're going to get and start your professional life.
The prime time of your life. And
Yes,
now
and
yeah.
I feel the 20s of my life have just been wasted, and I was reduced to nothing but being on bed. And when I tell people that I am unwell or I can't make it. I've had friends who have said shit to me like, oh, you can't make it, you're canceling. I try not to cancel last minute, but there are times when I cannot get out of the bed.
Yeah. And you can't help it either. You might be perfectly fine and with endometriosis, and all of a sudden you're having a flare up later on that day, and
Yes.
it's just a second by second kind of disease as well.
Yes. um so, like, for example, I was out yesterday, yeah, and when I go to work, I have a special chair and a footstool because I need to have my legs elevated. If I sit
Mhm.
with my legs down in a chair position, I start bleeding quite heavily. And somebody came up to me and asked me, "Oh, when you walk, you're fine, but why do you need all these extra things?" I don't want to be answerable to people who do not understand. I,
Exactly.
the times when I would want to answer people to create awareness, but I could hear their friends laughing at the back, you know, like they were mocking me. They think that I'm fine and I'm just lying and I'm creating all these things. There are people who are like, "Oh, you're being over dramatic. You are, saying things that are not true." But nobody understands.
Hmm.
It is extremely debilitating.
Yes, and I feel like that goes for both diagnosed patients and undiagnosed patients. Is at the end of the day, no matter what any doctor or any other person in your work or personal life has to tell you about it, you still have the pain. Like it's
Yes.
not going anywhere. You still are very sick with a horrible disease, and it doesn't matter what these people say. And I really do hate that. I feel like a lot of people, when it comes to a chronic illness, they take it upon themselves to educate you on your
Yes.
illness, and it's not true. And what they're telling you about are lies, and keep on creating awareness, I guess, is the only thing we can do, which I find I agree with you because there are times where I do want to create that awareness, like doing the video with you, but
Yeah.
it also can get very difficult too, especially when you are in a doctor setting. And
Yes.
sometimes you do get lucky where the doctor is like grateful that you're educating and they're all about it and they're going to go do research on it. But a lot of times you'll get the opposite of that where the doctor is like, who are you to tell me?
Yes, I had
Yes,
that
I'm,
endometriosis
yes,
specialist.
like I'm the one who knows everything. And
Yeah.
yeah,
So I had
so
to tell him that, I'm a biomedical scientist. So the books that
yeah,
you read were actually written by biomedical scientists. So, you know, I
mm-hmm.
know a bit more than you do because you would not have read the recent research I have. And you're going to take samples from me and send it to a biomedical scientist to look into
Yes,
somebody.
and you have the disease too.
Yes,
You know your body, so therefore you know more than anyone else right there on what is going
yes.
on and what you're feeling.
And, like, for example, as you said, you want to create awareness, like doing the video. This is very important. Like, people who are interested in knowing about the condition or supporting their partners or friends would be watching it and joining in and maybe understanding the condition, while there are people who, like, for example, another day was that there was a person sitting behind me kicking my chair, and I told them, "Please don't do that, it actually sends me jolts of pain in my body, please don't do that." And then they expected me to explain why.
Hmm.
Even a person who does not have a condition would find it very irritating if somebody's constantly, kicking their chair. But I had to
Exactly.
explain them that please do not do this because it's actually causing pain. And they were like, "Why?"
Hmm.
And I was just dumbfounded. I'm sitting in a special chair, which is a disability chair, and yet you expect me to explain just because my condition is not visible. On another occasion, I had a surgery for my knee, and the sympathy and affection I got from people around me for my knee surgery because it was visible, they could see it.
Exactly.
And endometriosis, they can't see, they don't understand. They say, "Oh, you are fine, you look absolutely fine, you're walking, you're doing everything," but they don't know to just go out. I have to take tons of medication to make sure, either before or after, and drug my body with all those things so that I don't feel pain. I can just spend those couple of hours in a nice way.
Yes, exactly. And here's the thing I feel about chronic pain is that we experience it on a whole nother level of pain all the time that majority of people, when they have acute pain and they
Yes.
have this going, they have appendicitis, and because I know, because I've had appendicitis and plus the endometriosis, and I can compare, and I'm telling you, endometriosis is much more painful. So they don't even have a level of understanding, yet we still
No.
have to live our life, and go about our days when we are capable of doing so. And
Yes.
there's just this a lot of opinions, but no understanding. It's an
No.
invisible illness, but we can't look like we're in pain 24/7 because we have
Yes.
this survival mode of, I will tell you, whenever I went to get my surgery done, I went through a whole bad things of doctors. My GP at the time actually had told me that because endometriosis doesn't show up on the
Yes.
sonograms or the ultrasounds. I got everything done. Finally, after 2 years, he just told me, you're a female, so you have pain in your abdomen from anxiety because females are more prone to anxiety than
Wow.
males are. So this is why you have the pain. Well, I just went home that night and I just looked up to the sky. I was in so much pain and I told God, I said, God, there is something seriously wrong with me. And it's like increasing as I'm praying. If you want this to be fixed, you're gonna have to do it. And that's all I can say about it. So
Yeah.
then the next morning I actually went in and saw a surgeon. Long story short on that, my mom had run into a surgeon and told him about me. And I just go into his office, no appointment. He checked me out, and I go into the surgery. And my point in all of this is I actually walked myself into the surgery. So no wheelchair, no anything. I have a cute outfit on. I just gotten from like I think I had two morning classes that day. So I was at school, went to go see the surgeon, full face of makeup, hair all done, but looked a lot better than I look right now, cute outfit. And I walked in, and the nurses were like dumbfounded. They just couldn't even like, are you sure you're getting surgery? Like, yep, he just sent me right on over. And like I had to wipe all the makeup off and then went into the surgery where all my organs had moved and detached, and you know how all that goes.
Yes. Yeah.
And yet, still to this day, I find the same doctors involved in that. If I go in there, they're like, you don't look like you're sick. Like they've
Yeah.
forgotten. And then that's another thing with people in the outside world. Is like, I love that example because going into that surgery with my organs tied, I had been living that day-to-day life for over 2 years, and you expect me to look like I'm in pain? Like, you
Yes.
expect, like, what do you want from us to show you? Not that we need to anyway, but it does
Yeah.
get very complicated on how to explain it to people, especially if they are being rude. Like, you don't look
Yeah.
like you're in pain. Well, look at
Yes.
you. You don't look like you're sick.
Yeah.
Especially with the invisible illnesses. It's like, actually, all my organs were tied up and
Yeah.
moved, and I looked like I just stepped out of a magazine walking into surgery. So
Yeah. I
what
think dressing up like that or putting makeup on kind of helps as well, that you feel like a different person, that
mentally it helped me a
yes,
lot. Yeah.
even if you're being pretentious and forgetting about your own pain, because
Mhm.
obviously when you go and meet people you have to put up that brave face and forget about your um, pain while it is all the time there. It's just distracting yourself from the pain as well for a wee bit of time, that
Mhm.
I'm not in pain and I can do things that were normal before this nasty disease took control of my life. And now it
Exactly. And there's kind
and
of like a normalcy of getting dressed, of putting your makeup on,
yeah,
and just kind of, even if it's just a 1% on like a bad day, it just makes
yeah,
you feel that normal life that you had, or as
yes,
close to as you were gonna get it.
exactly. And when you go out and then there are people who would be like, you look, you're fine, there's nothing wrong with you, and um why do you complain about pain all the time? And sometimes I feel like I don't want to complain because I feel like a burden. I'm putting my baggage on them, like people who are really close to me, but I can't help it. When I'm in pain 24/7, I need to explain. I feel like it is important to tell them that what can they expect of me, whether I can make it, I can't make it. And then the lecturing I get, have you tried this? Have you tried that? Do yoga, eat this,
Oh
eat
my.
that. And I'm like, you know,
Yes, it's awful, and I have yet to really find an appropriate, polite way to go about that. That, I see like a lot of funny memes in regards to situations like that, but have you found a good reply to them? Because,
um, no, I haven't actually, because I do tell them that, I end up bleeding because, if you do certain um, poses in yoga or positions, it will cause me bleeding. I can't do that. And to do yoga, I need to get out of the bed. Some people say meditation helps, but again, my brain fog would not help me meditate. You need to
yeah.
understand there's not one thing associated. You need to read up the condition. I tell them to read up the condition. It's not easy. There was somebody who said that, oh, when I am having my period or when I'm ovulating, they have no endometriosis. I think they have PCOS, but they don't have endometriosis. But they were telling about my condition, endometriosis, that I am in childbirth like pain only when I'm ovulating. I'm like, no, I am in that kind of pain 24/7. I get these terrible daggers in my rectum and my vagina where I feel like somebody's twisting a metal bar or something, and I get childbirth like labor kind of pains all the time. I have to drop everything and I have to hold my tummy. It's like
Mhm.
thunderbolts in
Yeah.
my entire
Mhm.
pelvis, and sometimes it gets quite bad. And because of that, I have physically become weaker, that anything small affects me more. Like, I feel like my body's in pain all the time. Like if you touch me, my body will hurt, my skin hurts. It's become that bad now. But it is very difficult. Like people tell me, oh, why don't you go on a holiday? Why don't you do this? I would love to. If only I wouldn't, if I go on a holiday and I get stuck because of my flare up, what am I going to do?
Mhm. Yes,
In that.
I do advise against that. I actually had made that mistake, and I ended up going back from Bali, Indonesia to the Midwest in America, which is probably as far away from my home. And I did
Yeah.
get stuck and ended up with a whole lot of endometriosis mess to deal with. And it
Yes.
was, I agree with you. That is, you can't just go. That was very eye-opening. I was much younger back then, and you can't just push through it and go do a holiday or go do this. You have to listen to your body, because what if you do get stuck? What if
Yes.
you do have a massive flare up? Like, or your brain fog. I've had that. That's another one to factor in too. I feel like a lot of people don't realize that you really need to factor in brain fog as well as the pain and the flare-ups and the bleeding to make
Yeah.
all of these decisions. And I know that in my personal life, I would say my immediate family now has gone out of their way to educate themselves a lot, but the extended family and friends, I experience a lot of what you're saying as well, and I feel like a lot of endometriosis patients can relate to that.
Yeah, I have lost some very good friends over the years because they just couldn't handle it. And
Mhm.
the ones who have stuck around are probably the ones who went out of their way to either understand the condition or learn from me because they want
Mhm.
to stick around. But then there are days where I feel I get upset because I'm just too angry at myself, at my body, that I feel like I'm not living a normal life, and what is the point of it all? Where am I going to head with it?
Mhm.
If I'm going to have a surgery now, 2 months I'll be okay, and then the third month the pain will be back. What am I going to do again? Am I just going to have surgeries after surgeries? Because recovering from a surgery, it itself takes so long to be better and back on your feet. I want to go to gym, and people tell me, oh, why don't you start exercising, go to gym, activities, go for
Mhm.
a walk. It will be good for your mental health. I can't walk. I need somebody to go with me. And
Yeah.
even if that is the case, next day my body will collapse. I am not going to be able to even use the loo on my own. I would need
Mhm.
help. Like there are days when I'm half in the shower and my arms get so tired from, shampooing my hair, washing my hair, that I just have to drop everything and come out. So it's not easy, and I don't think so everyone really understands it on, because my friends were like, um it was too much to deal for, to they couldn't deal with it. They couldn't deal with my pain. That, why are you shrouded with negativity? That's one thing that I hate.
Mhm.
I'm not bringing this negativity. When you're in pain, constant pain, terrible pain, where you think that somebody's stabbing you,
Yeah.
a million times, I don't understand how you be positive.
Yes, and that just breaks my heart. And I have also experienced some of that too. And it does break my heart for you because you're the one going through all of it, yet they can't handle it,
Yes.
which is kind of just frustrating. And but I will say one of the blessings might be that we have gotten to see who should be in our life and who should not be in
Yes.
ways that other people can't even imagine or go through because they don't have that test of chronic illness showing what people are
Yeah.
going to sit around and who won't. So,
Yes. And I think somebody in if there are people who know somebody with such a condition, chronic illness, any type of chronic illness, autoimmune condition, it's it would just be nicer if you educate yourself. If you can't educate yourself, you can't learn about, if you don't want to read up, just be nice, just be considerate, instead
yeah.
of shoving your opinions down their throat, because they know their body. How your pain might be totally different to mine. We might have similarities, but your threshold and my threshold would be different.
Mm-hmm. And
You know,
even among patients of the same
yes,
illness, like what could help you may not help
yes,
me. It
exactly,
even
yes,
yet here are all these people giving out their opinions on what you personally should do to get better.
yes. Like I had my excision surgery about 3 weeks ago, and since I've come out of the hospital, I'm not eating anything that I used to like eating. And I keep thinking maybe they have done something to me and I can't, enjoy the things that I used to like.
Mm-hmm.
Now I am, because again, it's hormonal, right? You know how you have pregnancy cravings. I have cravings of things that I don't usually eat, and they can actually cause flare up as well for me. So I
I
need to,
I have that as well, and I
yeah.
don't know about you, but do you ever feel like, oh goodness, what's gonna happen if it gets to the point where I can't eat any of this food now? Because I've noticed that in me where all the foods I used to eat, we can no longer eat now. And
Yes.
there's like this intolerance to it. And I do wonder if there is more with endometriosis on what you're saying than we all know and are aware of.
Yes, I think about it, and I think until recently I was just eating whatever I wanted to eat. But then I realized, I think last year, because I was at home and I was eating more food because of the lockdown. Before that, I was always on the run, either university, work, or something, and I never had time to realize that what was causing the flare up. But because I was home, I was not working myself out on anything. I realized that it was certain foods that were actually causing the flare up. And the moment I stopped eating, and I would actually feel it, I would eat it, and within an hour or two, I would have a massive flare up. And
Mm-hmm.
I realized that I can't eat them. And the moment I stopped eating them, I felt better. And it makes me sad that there are certain, these small things in life that we enjoyed.
Yeah.
I'm a big foodie. I love my food. And I can't eat certain things now, and it breaks my heart when I want to eat it, and all I have to do is think whether it will cause a flare up afterwards, and can I deal with it,
Mm-hmm.
or if I eat it. And then again, I come from South Asian background. If you don't eat certain things, culturally people get offended.
Yeah, I am Lebanese, so I completely, my family is like that. Especially my grandma is like that. I understand. It's like
Yeah,
very mean to them if you don't eat the food.
yeah.
It's
So I'm like, I can't eat it because I don't have any religious or cultural or societal issues. It's just that my body would not agree to it. And I
Mhm.
think it's very difficult for them to understand because I'm not allergic to it, like some people who
Intolerant.
are allergic to seafood, but it's just, it would cause me pain.
Yes, I put it in like a food intolerance category is what
Yes.
I refer to it as, and
Yeah.
it really does make a whole difference. I've gone through. I would say that was probably one of my first symptoms was the
Yeah.
food intolerances. I would eat something and then my stomach would be a basketball size and
Yeah.
have all of this endometriosis pain. And then throughout the last couple of years, it's kind of just that list has grown
Yeah.
on what I can and can't eat. So, but as long as I avoid them, I'm okay, more okay because it not worth it to me. I remember there were so many times I didn't want to upset my grandma,
Yeah.
little adorable Lebanese woman, Middle Eastern food, everything, especially if
Yeah.
she cooked it where I had to battle. Like I really don't want to upset, make her upset, but
Yeah.
I can't eat it because I don't think I can handle the amount of pain that's going to come from it. And there are
Yes.
these little aspects of life that we now have to consider gigantic mountains for us because of the illness. And I
Yeah.
know a lot
So
of people, when they hear endometriosis, they think just period,
yes.
only female organs. They don't see that it's all this other.
Yeah. And it causes other issues as well, like for example, heartburn, indigestion, and things that are related. If you have endometriosis on your bowel, it's a terrible, terrible. I think it's the worst thing ever.
Yeah,
Uh, you can't go to the toilet, or you're going to the toilet all the time. You're in pain when you're sitting on the toilet, and then you're never satisfied as well. So you have to be careful what you're eating so that none of your food is anything that can actually flare up that part of endometriosis,
Mhm.
because you are going to suffer. It does not matter how much medication you take for that. You know,
Yeah,
um, going to the toilet is something that it's a nature's call, and you can't help it, and you have to go through it in a certain you know time period. Otherwise, you're constipated, and that just adds to more complications, and it's
more
such a
pain.
pain. Yes, more pain.
Yes. And
And
that's how I feel like that was my dealing with that part of it was when you said it is worse than labor, is
yes.
when I really realized how high of a pain we do have because
Yes.
I had multiple people in my life have whether they were experiencing gas pain from post surgery or they don't have chronic illnesses, um, or they were constipated for a couple days, and these women had all had children, and
Yeah.
they would tell me like, I don't know what you go through or how you go through it because that pain from the gas or from the constipation was worse than any time I had given birth. And that kind
Yeah.
of just made me start thinking, okay, so our pain level, it's not anxiety like that
Yes.
first original doctor said. Like, this is our pain levels are getting to a point where it's on another level that I don't even think is healthy for our
Yeah.
bodies to be in
Yeah.
because that puts so much stress on all of us. And I'm sure that's going to be a whole different thing down the line on from having to deal with that level of pain, especially
Yes.
if it is on a daily basis.
Yes, and then the thing is, your body gets so used to the pain that even if you're not in pain, you feel like there's something incomplete, and it affects you psychologically.
Thank
um
you for pointing that out. Yes. I you kind of like have like wake up in a good kind of day and you do feel a little bit off. Like
yes,
you're not 100% there and you should be rejoicing.
yes,
And I think that's
but you just
another.
know it's the lull before the storm. What's
Yeah,
going to happen? That's
exactly. I will let
yeah,
you continue on that. I didn't mean to interrupt you, but I'm very happy you brought that up because that's another aspect of it.
yeah.
It's,
And especially when you're bloated and then the organs get pushed downwards, you know.
mhm.
And I have really terrible groin pain, and when I'm bloated, I look like I'm about to give birth. And
Yeah, but
well,
that's
while that worked in my favor in the London Tube, I get offered seats
yeah,
um, on initially,
it's
before the
so
new
good.
mayor has actually got this initiative where it says, please offer me a seat. You
Hmm.
wear that button, because he believes that not every illness is visible, and sometimes you are having anxiety, or like endometriosis is one of those conditions where you need to sit. I can't be standing in the underground throughout my journey. And there have been people who have been very kind and offered me seat. Either they thought I was pregnant, or they just saw my button and gave me the seat. But then there were people who were quite rude as well. Oh, you look fine, I'm not going to give you my seat. And it's quite um, traumatizing that you have to constantly explain yourself to people that you are
And,
in pain and you
and
cannot do certain
exhausting as
things.
well, I feel. There's an exhausting aspect to
Yeah,
that. Is because not only are you fighting this horrible illness, but you are researching it yourself. You're making
yeah,
decisions that doctors normally would make. A lot of times you have to be the one to make it on your own on what to
yeah,
do and what's going to help you the best way. But then to go out into the world and explain, and people asking questions and putting their input in and always explaining.
yes. And there was this one time when I initially became, it was last year when I became very vocal about my condition, because it was on the menstrual health day. I posted a picture with my symptoms and everything, and I shared it, and it went viral on Facebook in the South Asian community. And I got a lot of messages from people asking if I was okay, or there were people who wanted to share their experience with me, and or wanted advice, because um, in India, Pakistan, there is a lot of taboo involved with women's sexual and reproductive health. You can't talk about it openly. um, when I posted pictures of my scar, my surgery incision, somebody said, why are you taking off your clothes? I'm not taking off my clothes, I'm just showing this, the stitches from my surgery, that this is what happens, and I'm not trying to be sexy or anything over there. There's nothing sexy about a surgery, it's just my belly. If you get turned on, that's your problem. So then
Especially with surgery.
yes,
Sometimes you just have to laugh at the things people say.
I know, and I get all kind of weird comments in my, like I made a post about Bartholin glances that they keep recurring because of endometriosis or something related to endometriosis, or the sanitary napkins that we use all the time because of heavy bleeding. It could be causing, because of that. And then there was somebody mansplaining to me, explaining that you know it's because of masturbating, or other things. I'm like, are you real? Are you even real to say something? So yes, I had women, men, everything telling me all kind of weird stories.
Yes,
And
like thank you so much for giving me that answer. I had no idea. You just
yes,
solved all of our problems.
um, so I created a community for Pakistani and Indian women where they can talk openly, because a lot of women came to me and said that the doctors are not actually in Pakistan, not helping them. All they say is get married, have children, or they say that they're not going to do anything like a surgery, or perform or put in a marina coil through their vagina, because they're not married, they're virgins. So you
Mhm.
can't have all kind of treatments. And it breaks my heart. And I feel like I'm so privileged to be in a country where nobody's asking me questions about my sexual health or anything, or how many partners I have or not have. All they want to do is give me treatment. Although I
Mhm.
have bad doctors, but I feel very, very privileged in that sense that I can get the treatment. But there are women who are suffering in silence in all those countries where it's still a taboo to talk about women's health.
Mhm.
And another misconception I think a lot of people have with endometriosis is they think if you get hysterectomy, you'll be cured.
Oh, yes. And I will
You know,
say, did you started a page though for these women or
I
group?
did. I have a Facebook
Okay.
group, and
Okay.
that's why I created this page as well. That here I
I
can
would
it
actually like to share that if you wouldn't mind later
yes,
on to get
yeah,
that. I
yeah.
love
It's a
that
Facebook
idea.
group, and I'll send you the link.
Okay.
So hysterectomy is not the cure of endometriosis. If you have adenomyosis, yes, it will help you, but not endometriosis.
Mhm.
Because endometriosis is just on the outside of the uterus. It's not affecting the uterus itself.
Yes,
My
and it
uterus is
can move
healthy.
elsewhere as well too.
Sorry?
And it can move elsewhere as
Yeah,
well.
yeah,
So even with all that gone, you can still
yes.
be having the symptoms.
And exactly, like I spoke to the nurse two days ago as a follow-up on my surgery, and I said I'm still experiencing some pain in certain areas where they have said that they've removed endometriosis from
Mhm.
completely because it was an excision surgery. And she said that you need to wait for 3 months to see, because the post-operative pains will go away in about 3 months. And if you still have the pain, then we need to look at other tests because there might be endometriosis on the nerves or other areas of fatty nerves, lipids, or lymph nodes, which we could not have seen during the surgery. And then there would be alternative therapy. And while I was on the mend, thinking, yes, I have had the excision surgery, and in 3 months' time, once the pains from the surgery are gone, I would probably have a normal life for at least a while. And then this comment from her has just put me back to square one, that there might be still some endometriosis left, which can continue to grow and make
Yeah.
life worse.
That I do remember the first time I did see you post that it's not a cure for
Yes.
endometriosis, and there is no cure.
No.
And I love that you're repeating that again. I feel like we can't say it enough that a hysterectomy, although it may help some, there still
Yes.
is this chance that
I
it could
am.
be elsewhere and grow more.
Yes, and I am on a lot of endometriosis support groups in the UK and the global ones as well. And I've read posts about women who have had hysterectomy, full hysterectomy as well,
Hmm.
and yet it has come back. And they say when it came back worse than when they had their organs intact. And
Hmm.
my answer to those people who actually told me to get hysterectomy done was, even if it had 50% chance of me having no pain, I would have done it. I'm child free. I don't want kids. I can say goodbye to my organs right now because they're not going to help me in any way. And I'm not going to change my mind. I'm very certain. But it does not even have 50% chance. There is no concrete study. We've not had a big sample to show that, yes, it definitely cures you of endometriosis. It does not.
Yes. Hmm.
Endometriosis is basically on other organs. Um, and even, again, I'm not going to equate it to cancer, but if you look at the theory, cancer, when you have removed the cancer, even if you leave one cell behind, it will regrow, it will
Hmm.
come back. And I believe endometriosis does the same thing. If little bit of it is left behind, it will regrow because that's what human body does. It regenerates.
Yes.
And it's a part of, cancer cells are basically cells which which were once your body cells, but something went wrong
Hmm.
and they started to mutate and became cancer cells. In the same way, endometriosis forms the adhesions or lesions or cysts or whatever kind of endometriosis you have. If you, again, it's a part of your body which has gone wrong. somewhere something went wrong.
Mm-hmm.
So it will reproduce and divide and mutate, and probably when it comes back worse. It's just, again,
It
like
does.
antibiotic resistance. So, they know that, something else is going to come and stop me from growing. So they will be stronger next time. Human body is very clever.
Yeah.
When it comes to conditions like this, they will go dormant for a while, and then when they come back with real force, which is
Mm-hmm.
not, um, you know, bearable. It's quite painful. I have seen researches being done on silly things related to endometriosis, but no funding for endometriosis and finding its cure. There was a study in Australia a few years ago, and that the study was actually about how it affected a patient, an endometriosis patient's partner's life,
Mm-hmm.
sex life, like how he could not have sex with his wife because she had endometriosis. So if instead of using that money on the research of men's sexual life because of their partners having endometriosis, they spend that money on finding what was the cure or the reason,
Mm-hmm.
probably we would have less. 1 in 10 women is not a small number.
No.
It
No,
is a massive number.
and especially if you add in the ones that are undiagnosed,
Yes.
that are getting pushed aside, that never even make it to the point of surgery to go in there for their doctors to see that this
Yeah.
is endometriosis. When you
Yeah.
factor all of that in, it's much larger number, I would imagine, than what they have even on record. And
Yes. Like, I don't think so. It's 1 in 10. It's probably more than that. And like as you said, some people who do not even get diagnosis. I know a lot of people who, um, a few years ago, people were asking me to get married and all that. And there was this one lady who actually told me that if you're ever getting married, never tell your future partner that you have these conditions because they won't get married to you. And again, this is a very societal or cultural thing. I think that would be unfair. If I know, I should tell them that I have this condition and I may not be able to have children. I may, you know, with endometriosis, you can have, you can't have, depending on how bad the endometriosis is. So
mhm.
this is something you need to discuss before you commit yourself to somebody.
Yeah.
Unless you don't know, that's a different story.
Yeah, unless you don't know, yes. And
Yeah.
I do struggle with that on when is the time to, I used to, not now, but when is the appropriate time to tell someone that you are dating them? For me, whenever I first had my surgery and a lot of it just like, whoa, life-changing moment. I was actually engaged at the time. And so it was instant after that. But even being engaged, it was a very difficult conversation to have.
Yeah.
It was very difficult to even begin the conversation, I feel, because he very much wanted children, and I still believe we'll make a perfect father someday, and
Yeah.
it is very difficult to go about it, kind of going back to not only is it physical, but there's a lot of mental things there too to deal with. On, do you have an opinion on when is it okay to go about that? Because I know I've seen a lot of females ask questions like that. I used to be on a support group on Facebook with endometriosis, and when is it appropriate to go about saying like, hey, by the way, I may not be able to have children, or I have this endometriosis, and
Well, the thing is, it depends on, I would say that you need to see whether you see yourself with that person in the long run or not. Once you think that, this is the person that I want to be with, I think that's when things start to get serious, probably just before that, so that there's not much heartbreak in case you two decide to go different ways after that.
yes.
If you go too deep into the relationship where you have set a wedding date or you're dating for years and then you tell them, then I think it's unfair on the other person as well. And if they choose
Mhm.
to leave, I don't think it's anything wrong. um, but to save yourself the heartbreak, I think when you realize that this is the moment. I feel that I used to get a lot of male attention before I became vocal about my endometriosis. Men run away.
Yeah.
They don't want the
Any
baggage. They
chronic
don't want to
illness,
deal with it.
I feel like any chronic illness, they just go. But I try
Yeah.
to look at that as a blessing as well.
Yeah.
Who really is going to be meant? Like, are you worth being in my life? Are you worth my
Yeah.
time? And I feel like kind of being vocal about your illness just makes it so much easier and quicker to see like who is
Yes,
going.
you can filter them out
Yes,
easily.
you're
Because
right.
I think somebody who wants to be with you will be with you through thick and thin.
Yes.
Like you can have an accident after you get married as well and become crippled or anything, right? Lose a limb.
I
And
use that example. I just used that one the other day so often that you never know what's going to happen.
yeah,
You could marry a perfectly healthy woman and then
yeah,
you don't know what's going to happen the very next day. She could get in a car accident and it's just,
yes.
you never
So
know.
yeah, if again, why would you run away if you're really sincere with somebody, you want to be with them? I had a lot of men who used to flirt with me, but then I realized they don't want somebody who's sick and in bed. They would rather not come and sit and watch movies with me, just be in bed and cuddle, or you know, bring me treats that would help me make myself feel better. They would rather be with somebody who's very outgoing, funny, laughing all the time, no negativity, no depressive thoughts or anything, so
Can
that
go on
they
an
can, yeah,
adventure, do this. Yeah.
yeah. So I think that's what is one of the, which is a blessing in disguise, as you said. I don't have to deal with a lot of unwanted attention, but yes, I do think that it is unfair for women who have these conditions and want to be in a relationship with somebody, and they can't because of all this. um, and there was this one person, my mother was telling me the story, in our neighborhood back home. This, I don't know how old she was. Probably she was in her late teenage years or early 20s. And she complained of pelvic pain. And her parents were like, no, we're not going to take you to gynecologist because, in our society, it's not a good thing, a woman going to gynecologist before getting married. I don't know why, because the moment you start your menstrual cycles, I think you need to have regular visits to a gynecologist, and
Yes.
because you need to see if you're all right or not. And the woman never got to the hospital, and eventually they found her belly was getting bigger, and they thought, maybe she's just had an affair and got pregnant or something. And when they finally, when it was showing, they went to the doctor, and they realized that there was a massive, massive tumor. And
Wow.
within days, it it was probably a cyst which turned into a tumor, and then it burst and she passed away.
Oh, wow.
So it is very important. I don't care what people think, but I think it is very, very important for at least women to take their daughters to gynecologists. If men do not want to because it's a taboo and all that, I think as mothers, women should take that initiative and take their daughters um, to doctors. Like today, I had somebody, or yesterday, I had somebody on my group, and they were having some issue. And I told them, "Are you having Pap smear tests regularly? If you're above 24, you need to have one every 3 years." And the person got scared, and she was like, "I think that's for cancer, isn't it?" I'm like, "No, that's not for cancer."
This was
And
really,
there's there's really no education, there's no sex education, there's no awareness about female health. There are women who get married and who have kids, and they have no idea about their own bodies. And
and I hate that. It breaks
yes,
my heart, and I just
yeah,
wish that we could just snap our fingers and and take care of it. But I will say that unfortunately, here where in America, where this is all very well known at a young age, and we don't deal with those issues, I have unfortunately come across with a lot of doctors, even in that field, where they're not listening to the patient. So the tests were run, things were, the pap smear done, and I had had a fallopian tube burst, and it was 2 years. I am only here and alive because God obviously has some plan for me that I'm not aware of yet. But for 2 years, it had been burst open from the endometriosis, and none of the doctors were listening to me at that time. So I think it goes both from like at a home standpoint for the education and to get that across, to all the way into the medical field, to
Yes,
listen to your patients, to
yes. I
believe them,
think that is
whether,
one of
yeah.
very important point what you raised about doctors not listening. Um, I what I think I have come to this conclusion that if you want to be heard, you need to make noise.
Yeah.
And if you don't
Yeah.
make noise, they'll walk all over your head. So
Mm-hmm.
in February this year, I had my endometriosis specialist appointment, which I waited for years. Initially, they gave me a phone appointment. I understood last year was COVID, and because of that, I would not have forced myself. I did not want to go to hospitals myself.
Mm-hmm.
But when I went to the doctor and I'm explaining him my symptoms, and I'm telling him that I've been bleeding since last year, August, from my urethra, from my vagina, from my rectum, instead of getting worried that this person is bleeding, and it's not sporadic or light bleeding, it's heavy bleeding from all three passages.
Mm-hmm.
He told me he does not want to open a can of worms. And that I I lost my shit and I actually cried. And then he told me, oh, like we were discussing earlier, that I know more than you do. And then I had to tell him off that, you know what? No, you don't. I
Yep.
live with it. You're a man. You don't even understand what period pain is.
Mm-mm.
And then finally, when I had my excision surgery, first, when I went in, they asked me, do you really want to have the surgery today? Because they were running late. I was like, yes, that's the plan. Because see, the COVID cases are going up again,
Mm-hmm.
and hospitals will be shut. And I'm glad I had that surgery on that day, because otherwise I don't know when I would have my surgery, and I don't want to live in pain.
Yeah.
And the next day when I woke up, and the surgery went on for quite a few hours, that they could not, initially they said it was a day procedure, you could go home the same day, but because when things went wrong, probably because they realized there was much more endometriosis inside me than what my previous laparoscopy said, um, it went on for more hours than they imagined, and I had to stay overnight. Next morning when I woke up, the on-duty nurse told me, the doctor has signed you off, you can go home, please call somebody from home to pick you up. And I was like, okay, but I need to speak to a doctor first before I leave. And she was like, oh, but the doctor has signed you off. And I said, I'm not going to go until I speak to a doctor, because I need to know what did they do. I have no idea what was done to me. I'm
Mm-hmm.
still a bit dizzy from anesthetics, and I'm not even used the loo yet. How can you expect me to leave? And then she sent a doctor, and it was a junior doctor. I asked them, were you present at the surgery, during the surgery? And they were like, no, but I can tell you what the doctor said and what were the findings. I'm like, I'm not going to talk to you. I am not going to talk to you. I need to talk to my surgeon, because that was agreed that I am going to have a consultation with my surgeon before I leave. And the
Mm-hmm.
person said, um, he might not be in. I'm like, I'm not going to leave this bed until you call somebody, because before coming into the surgery, I was under a lot of mental health stress, because the week before the surgery was extremely painful, and I was self-harming. And I said, if you let me go today, I'll probably go home and self-harm. And then they go like, oh, are you threatening us? I'm like, no, I'm not. I'm
Mm-hmm.
telling you that this is the mental state I'm in. And I have waited 7 years for this surgery. I had this, and I was promised something. And if I'm not going to get it, I'm not leaving. And within hours, I had a whole team of endometriosis specialists, nurses, pain specialists, bladder and bowel specialists, whoever was during the surgery present at my bedside. And I realized that, in 2016, when I had my first surgery, I didn't even ask them anything. I was still under anesthesia. Within I think within 2 hours of my first laparoscopy, somebody came and told me what happened, and then they left. Second surgery, nobody even bothered to come. So I realized that I need to make that noise. I'm not,
We
it's
have
my
to
body.
advocate for ourselves. It's very unfortunate and sad, and I hate that you had to go through that, as many patients do. It's awful. We should not have to advocate for
Yes.
ourselves as much as you did have to. It's a constant battle and fight, and always advocating for yourself to just get the treatment that you need done. And
Yes.
I feel like a lot of other illnesses, especially when you bring in cancers, they don't necessarily have to on the level that we do.
Yes.
Or if it's an acute illness, you know, these patients aren't advocating for themselves as much as we do. And it just brings like a whole nother level, as you just shared with us. And we should not have to be dealing and fighting this illness with all of that on top of it. Because we
Exactly.
don't need anything else to pile on. Yet here we are.
Yes. And I think in medical schools, they should add another module of bedside manners for the doctors, and how, as you said, you need to listen. Active listening should be included in medical courses. Otherwise, you shouldn't be given your degree if you cannot listen to your patient.
No,
Because
because your
I
patient is
know,
telling you the diagnosis. All
yeah,
you need to do is sit there and listen to them, because they're
yeah,
telling you
yes,
word for word what is going on.
I actually hate it when they say, "Oh, just answer me in yes or no." It's not a yes and no. It's not black and white. There's a whole area of gray when it comes to health. Like
Mm-hmm.
for example, if you are telling me that I've given you this medication, you tell me, did it help or not? I need to tell you that it helped on certain days because I did not do other things, and it did not help me on other days because I went out or I got up from my bed. So if I'm lying, like I was on Zolodex for 4 months, and I have to explain all the other. Yes, it stopped my bleeding, it stopped my endometriosis pain,
Mm-hmm.
but the other issues it gave me, my bone pain, mental health, I felt I was possessed, like in a horror movie or something, the way I was acting,
The
the
side
way I
effects.
was shouting on top of my lungs.
And that's
And
a very important thing to tell your doctor. I feel like it's never a yes or no
yes,
when it comes down to
and
it.
when they say that, just say yes or no, I can't. It's like a lawyer in a courtroom trying to
Mm-hmm.
put words in my mouth that just say yes or no. Were you present or you not? Or did you see the murder happening with your own eyes? I felt like it was courtroom
Mm-hmm.
drama. uh,
Exactly. We wish it was were that simple, where
it was
like
I wished, yes. And the reason why I think it is very important for people like you, or all the other bloggers or whoever is creating awareness, that fine, we are dealing with it, and we are trying to fight our way through it, but I hope for future generations it might make it easier for them to deal with
I
it.
hope I hope so much. That's why I'm
Mhm.
such a huge fan of precision medicine, meaning you only look at the patient as an entire being. You don't compare them to
Yes,
anybody else. It's their environment, their genetics, everything that makes them them. And that's the
yes,
end of the story. And I do hope with endometriosis and all of this that in the future, as you said,
yeah.
they won't have to be advocating for themselves or fighting or dealing with all the extra things that none of us should be having to deal with, because it's
Yes, like,
already too much to handle on its own.
yes. And how you just mentioned that, it's very important for doctors to consider it as a whole being. My personal experience with that was that I had my laparoscopy in August last year, 2020, and then I
Mm-hmm.
had a knee surgery in October. And for the knee surgery, I was in rehab. I had to do physiotherapy and all that. And my regular physiotherapist was on wards after the COVID outbreak this year January, when we went into lockdown in the UK. So somebody else took his call and called me, and they were like, "Oh, you're 3 months into the surgery and you've still not done this." And my usual physiotherapist is very understanding, and he understands that, I have a
Mhm.
lot of other conditions. And if I'm not progressing as compared to somebody who should be progressing at 3 months with no conditions,
Yeah.
it's fine. But this person gave me a piece of their mind, and actually I felt like they were shouting at me that I was not doing enough. And I told him that I am still recovering from my endometriosis, and I bleed, I can't bend down, I can't do certain exercises, so my exercises have to be tailored according to my physical health condition.
And this is
And this,
another perfect example of you should not have had to do that.
yes, and I had to tell them, for
Mhm.
me, for you, you're just dealing with my knee. I am
Yeah.
dealing not only with my knee, I'm dealing with my endometriosis, I'm dealing with chronic fatigue, I'm
And your
dealing with
body,
fibromyalgia.
yes, your body is not just your knee. You
Yes,
have to look at the whole entire being of a
yes.
person that
And I
makes
think
them
that is
think.
something every doctor needs to understand, that whether
Yes.
it's orthopedic, whether it's neurology, whether it's anything, you need to consider that it's one person and they may have other issues as well. So you
Hmm.
need to take in consideration. Like I went for recently for my neurology appointment after a year and a half, because I don't know what happened last year after my laproscopy, whether it was the gas elevating, it dislocated my um, C4, C3 in my neck.
Wow.
I was lying down and I was just turning on my side and it just dislocated it. And I went into A&E. They did not do anything. They just gave me um, some suppository, some diclofenac suppository, and they were like, off you go, you're fine. Later on, an MRI was done and it was shown that my GP did that MRI and it showed that I had dislocated the thing. So finally, and he sent an urgent referral to neurology to see, or neurosurgery actually, to see what's happening and what can be done. But they kept on delaying, and and finally, when I got to see him, it was an Indian doctor,
Hmm.
and he was sexist. He had patriarchal um,
Hmm.
mindset, and he kept on saying, you're too good looking, you're too young to get sick, you have so many issues. And then he was like, why don't you cook something? I think you should take cooking as a hobby, I'll tell you where to buy Indian spices. I'm like, you know what, I have mental health issues, and when I see a knife I want to stab myself. I don't think it's a good idea for me to cook. And no, I'll tell you where to buy Indian spices. And I'm like,
Oh, and since when does good looking have anything to do with whether or not you can have a chronic illness?
yes,
It,
or the age as well. I mean,
Yeah,
kids have
exactly.
cancer. Kids who are just
Mhm.
born have cancer. They can be born with cancer and other conditions.
Exactly.
So how can
It's,
I not have a condition? And honestly, I tell people, if I was given a choice, I would not want this condition. I did not choose it.
mhm.
If nobody would want to be in that condition. I sometimes I can be very aggressive in what I say, but if somebody like me, if I hate a person, I just hate them. I can't stand them. But if I if I say that I would not wish this condition on my worst enemies as well, then you need to understand how bad this pain is.
Yes, I actually was with a patient who deals with the exact same thing in pain, and it was asked like something about, don't you wish that you could just let your doctor feel it for 30 seconds,
Yes.
1 minute, and then they could realize what you're really dealing with and they'll take you seriously. And I was like, no, I really,
Yeah.
I get where you're coming from, but no, I could not even allow my worst enemy
Yeah.
to deal with this pain.
So, when I had my excision surgery, because I asked for all these things, that I want to see a doctor, I want to see all these people. So everyone became quite rude towards me, and I felt there was a lot of racism and everything involved because I was the only person of color on the ward,
Mhm.
and probably the youngest as well. But then there was this one lovely, lovely black nurse who came, uh, I think after a couple of days on duty, and when she was reading my notes, she pointed that she had endometriosis as well.
Oh, okay.
And she was so kind to me. Every time I went to the toilet, she would, because after the first time when I went to the toilet, they were like, oh, you don't need to ask permission, you can go on your own. And I was struggling because I felt dizzy every time I got up.
Mhm.
And then this nurse who came and who had or who has endometriosis, and she realized, she would actually help me get up and would stand outside the toilet, kept on asking me if I was in for a little longer, kept on asking me if I was all right, if I needed anything. uh, you know,
Mhm.
got me things as well, like water, medicine on time, and if I wanted anything extra for my lunch because I was not able to eat everything that was given to me. So I thought that just because she has that condition and she understands how bad the pain is, she's nice to me, while um, other people, are not really that sympathetic.
Mhm. And I'm very happy that you did come across her and
Yeah.
have, but I feel like everyone should have been treating.
Sorry, my phone just went away.
Oh no, you're fine. I'm actually sorry. I'm gonna have to cut this now,
Yes.
but I really enjoyed. I even learned some things from you, and I'm sure many patients out there did. Thank you for continually sharing and, like you said, making noise about it. And I really
Yes.
hope that we can do a little part in changing it for the future.
Yes, and this year on during the Endometriosis Awareness Month, um, in the UK they came up with a hashtag which was Endo the Stigma,
Mm-hmm.
and
Oh,
that's
yeah.
the name of my group as well.
No,
So I think we need to make noise. We need to be heard. We need to make it into um, a normal subject that people can talk about, so that we can all get together and end the stigma around women's physical and mental and reproductive sexual health.
I completely agree. And that is endo, the
And
stigma.
oh, the stigma. Yeah, I'll send it to you in
Okay.
writing.
I love that. It was very creative. All right. Well, thank you for
Thank
being
you.
here today, and I will talk to you soon.
Thank you for having me. It was lovely chatting with you.
Bye.
Take care. Bye.